Now, the other thing that came up in your questions about problems in the sacrum, because if you come up to sit cross-legged, and maybe you have the right shin in front, I'll explain why later. And we're just going to take a twist to the right. So take the right hand behind you, left hand to the knee, and twist around to your right, land the left hand. And notice what your pelvis is doing, because your pelvis is kind of following your chest. So as you turn to the right, you feel your left hip bone is pulled forward, and your right hip bone kind of rolls back a little bit. So the right side, you're kind of tucking under, and the other side is tipping forward. Go to the other side, left hand behind you, and twist. Again, the pelvis is getting pulled by the chest. The right hip bone's pulling forward, the left hip bone's rolling back, and come back to center. And that causes problems for the sacrum because you're outer nudity on one side and nudity on the other. So the sacrum's going kind of cattywampus. And I mean, the sacrum is able to do that to some degree, but if you overdo it, it creates the pressure that becomes sacroiliac pain. So we actually want to stabilize the sacroiliac joint a little bit more, and then do what's actually a twist. Because when I do this, I'm not twisting because everything's turning in the same direction. That's just a rotation. A twist is when the two ends go in opposite directions. So from cross-legged, take your hands behind you. And it's okay to be up on blocks. You can have hands on the blocks. Lean back, press the hands down. So you just get that little bit of arch in the back, kind of like what we're doing in the Navasana, not too extreme. So you get that little arch from the multifidi, and then you can draw the lower belly in and up. And lower belly is right down there above the pubic bone. As it draws in and up, it just helps to stabilize the sacrum. Now, imagine on the left side of your lower belly, you can firm like you're turning your lower belly a little bit to your left. So you bring more weight to your left sit bone. Does that make sense so far? Does that little sense? You're firmer on that side. Now, with right hand behind you, take your left hand to your knee. And before you turn the upper body, press the back hand down to arch the back, firm the lower belly, especially on the left-hand side, keep the left sit bone grounded, and then use your arms to twist your chest to your right. But the lower belly is still turning a little bit to the left, keeping the weight on the sit bone. Then you feel the twist more in the spine and the chest, and not quite so much in the SI joint. And then back to center. I feel good on the back? Yeah, that's more safe and secure. There's still a little bit of movement in the sacrum in the joint, but not so much that it gives you sacroiliac pain. Now, to go to the other side, it's good to have, when you go to the left, it's good to have the left shin in front, just because I find it helps to stabilize the pelvis better. If the right shin's in front, you feel the pelvis turns a little bit more. That's the only reason. So take your left hand behind you, right hand to the knee, lean back a little bit. As you press the hands down, you arch the back, lift the belly, turn the belly a bit to the right to ground the right sit bone, take a breath in, and then use your arms to turn your chest to the left, but the lower belly is still resisting to the right to keep the sit bone grounded. And you feel like you're spiraling upwards through the spine, and it feels nice around the rib cage. You're kind of wrapping the ribs around, and then inhale back to center. So that gets the whole body to twist instead of just turning around in your pelvis.